Hey friends, I think I am live now. Hopefully y'all can hear me. If you're live on here with me, just let me know that you can hear me on the chat here. Let me just type that in real quick here. Say hello if you can hear me. Let me know where you are from. Love to hear where everybody's from. I don't have any feedback here. I've been having little glitches with my computer on the audio. So we made some changes. Hopefully this works out. But let me get on with the title of the video today. This is going to be I'm so sorry. Yes. Can a knee alignment problem cause a meniscus tear? So if you are on live right now, let me know if you can hear me. I need some feedback to make sure that my audio is working. All right, so let me get on with it here. If you have any questions as we're going on with this talk today about can a knee alignment problem cause a meniscus tear, just interrupt me or type in your question in the chat. I'll get to it. I'm going to be stopping as I talk through here to answer questions. So just let me know. All right, so there's two types of alignment problems, and this is really important to talk about for meniscus problems because it's rarely ever discussed. If you have a meniscus problem, you will typically go to the doctor the typical way that, oh, great, Ruxana Vergi. Hey, Ruxana Vergi, you can hear me. So if you have a meniscus problem and you go visit your doctor, your orthopedic surgeon, or whoever, they're going to do an MRI and see your meniscus on the MRI, or sometimes they'll do an X-ray too to look at the height of the knee joint. And then they'll make their diagnosis from there. And they'll never talk about alignment problems because that's not their specialty. They're trying to look and see what they can treat with medications. Surgeons trying to look and see what he can treat with surgery. But if you think about the alignment of the bones and the way that they're moving, you can fix a lot naturally without ever having to go through an operation and put yourself at risk of the infection and all the secondary problems of surgery. Plus, if your primary reason for having a meniscus tear is an alignment problem, then you'll never get that addressed if you go have a surgery or if you just take pain medication or get an injection. So it's critical to learn about this and make sure that if you've got an alignment problem, then you've got to address it. So Vinny S says, I have knee pain, but nothing shows up on an X-ray or MRI. I have on lower part of the kneecap, on both sides of the kneecap, how to fix alignment. Yeah, we're going to talk about exactly what to do to fix alignment problems in your knee today, Vinny. So just pay attention and we'll get to it right now. Let me just explain about what these look like. So I've got my knee model here. The two problems that you're going to see. Number one is going to be a joint alignment problem. So if you're looking at the knee, just to orient you here, here's the kneecap, here's the thigh bone, here's the shin bone, and here's the fibula. It's this little bone on the outside, and down there's the foot. So we're looking at the right leg here. This is going to be your right knee. So in the knee, you typically have this motion, right? Knee bending and straightening. And everybody thinks of the motion happening in this direction. This is called frontal plane movement. So for those of you that know about the science of this, but there's a little bit of rotation that happens in the knee and a little bit of sideways motion that can happen in the knee. And if your knee has come up to this problem where you have a joint alignment problem, what could be happening is if you look, I'm going to contrast this on my shirt right here because it's dark and this is light. If you look at my finger right here where I'm pointing, right there, here's the edge of the thigh bone on the inside of the knee. This is your right knee. This is the inside. This is the outside. This edge of the thigh bone right here should be about in alignment with the edge of the shin bone. They should be right on top of each other like that. Maybe even a little outwards on the shin bone and a little bit inwards on the thigh bone. But if your knee is like that, that happens in people. And maybe it's not this dramatic. Maybe it's more like that, a little more subtle. That problem right there can cause some massive knee pain. And because the meniscus sits right between these two bones, the thigh bone and the shin bone, and it's attached to the top of the shin bone right here. So whenever the shin slides over like that, it pulls the meniscus over with it. And now the thigh bone is going to be rubbing on it inappropriately. You bet you can get a meniscus tear from inappropriate wear on the meniscus from the thigh bone because of the alignment. And this isn't something that doctors are looking at on an X-ray or an MRI, they're just seeing the side effects of it, which is a torn meniscus and knee pain. So to fix this, because I think that's what Vinny's asking here, how to fix knee alignment. So he's got some more comments here. What kind of alignment problem and how to know I have an alignment problem? What's the diagnosis? Yeah, I'll talk about that. You're jumping the gun here, Vinny. I'm going to get into all of this today. To fix this, there's multiple ways. I've created a video on how to fix this on your own. Of course, seeing a specialist therapist like myself, a manual therapist, they might know how to do this, how to get it back in a position. And it's not just shoving it in a position. I mean, that's part of the treatment, obviously, but it's keeping it there. That's the harder part. That takes a longer term fix. Now, before I go into the details on how to do this, Vinny, let me talk about another alignment problem that actually feeds into this one. So the other alignment problem is your movement. If you look at the whole leg here, this is, let me kind of mirror this. I'm actually going to stand up on the table for you. So this is my right leg right here. When you go to move, remember that knee alignment problem that I showed you right here on the inside of the knee. If you tend to bend your knees and your knees come inwards like this, that's not good alignment for the knee. So to zoom in for you, if you bend your knee and your knee goes inward like that, you see how the knee joint is going to shift. You need to make sure that when your knee bends, it's bending more like this. Even outwards is beneficial, but not inwards. That's one of the worst positions you can move. You're tensioning a lot of tissues there. You're tensioning the ACL, all the other ligaments in the knee. Your knee's not designed to move inwards. So this is what I call a movement alignment problem. We have medical terms for this. Here in the clinic, I call it a hip anterior glide medial rotation syndrome, which means up in the hip joint, you have the hip tends to move inwards like this, which turns the leg inwards. So when you go to squat, when you go to sit down on a chair, if your knees tend to move inwards together like this, that is typically because your muscles here on the front of your thigh are dominant, and the muscles on the back right here, the glute, are not very strong. These muscles back here are responsible for keeping your knees moving outwards. So if you tend to sit down and these muscles in the back are weak, these are strong, then you're going to tend to want to go inwards like so. But if you figure out how to use these muscles and you think about moving your knee outwards, then your alignment in your knee joint is going to be a lot better during motion. So if you're catching this on the replay, rewind that. You might need to watch in slow motion to listen to all the details there. But that's the movement problem that almost everyone with knee problems that I see here in the clinic has. They're moving their knees inwards too much. And maybe it doesn't even look like it's in a dramatic inwards motion, but it's more straight. And if you think about the muscles being used, what I'll often do, I'll have people do a partial squat, and then I'll just tell them, what muscles do you feel are working? And as they hold it there, they'll point to their thighs on the front of their muscles. They'll point to the muscles in the front of their thighs, which tells me that they're not using their glutes properly, which means the moment of motion right here happening on the inside of the knee joint is going to promote, it's going to make the shin want to move inwards and cause that tibial shift. And then the pressures are going to be off on the meniscus, which is going to set you up for a meniscus tear in the future. So I hope that makes sense in how these two problems are related. The joint shift, the joint alignment problem, and then the movement alignment problem. The knee isn't moving in this direction, straight and out a bit. It's moving more inwards, which promotes that joint shifting. So you can ask questions about this. I'm going to go into some more details about how to fix it here in a second. Let me just get into the comments here. So Vinny says, how to know that I have an alignment problem? What's the diagnosis? Great. So you're typically going to have pain on the inside of the knee. So on myself, let me set up the camera angle slightly differently so you can see my knees. So on myself, it typically hurts on the inside of the knee if there's an alignment issue. And if you just run your thumb like that, and you can feel those bumps that I'm talking about, it's kind of hard to know exactly where they're at. I've got a video that talks about it, but like right here's my thigh bone, and then there's the drop off, and my alignment is good, thankfully, and it's not tender. I mean, if you poke stuff, it might get a little bit tender. But if you compare with your other side, as long as your other side doesn't bother you, it should be different on the side that bothers you. You should have a lot more tenderness on that edge of the bone where it's sticking out into the middle. So that's the primary diagnosis. The way that I diagnose it here in the clinic, I'm looking at the muscles. So if you're using your quads quite a bit, then that's a sign that you're probably going to have that shift. I'll have people do a few squats up and down, and their knees tend to come inwards. Or I'm just watching them too when they walk. If their toes are pretty straightforward, or even a little bit inwards when they're walking, or when they go to sit down and stand up from a seat here in the clinic and their knees kind of buckle inwards. They look like this. Let me show you, because you might see this in yourself. I'll say, okay, come on over here. They're in the waiting room, and then they'll get up and they'll go, whoop. And then they go back into the clinic, and I tell them, okay, have a seat on the chair in the clinic, in the treatment room, and then they sit down like this. Without me having educated them about anything or made them aware of these movements, I'm already seeing that their tendencies are there to use their quads too much, and they probably tend to have weaker glutes. And so then I'm just confirming by hand what's going on inside the knee, as far as the joint position. And then I'm looking at the muscle strength around the hip and the thigh to diagnose the movement problem as well. And then as far as treatment, then we've got to talk about getting strength in the right muscles, typically the glutes. A certain hamstring muscle on the inside of the thigh can help maintain the alignment of the knee joint. And then just taking it easy and gradually progressing into more advanced activities with proper form, with proper squat form, making sure the knees are aligned properly is critical. So I hope that answers your question, Vinny. The Yuha says, my doc said my foot is causing the misalignment and gave me arch supports. It has been a month, still sore, started some exercises. Yeah, that's a great comment that you have there. So let me talk about the foot and how this connects to this, because it is very related. So here's the foot of the same leg that I've been looking at, and there's the arch right there where my finger's moving. And an arch support would be giving some support to this inside part of the foot. And that's important because if that inside part of the foot falls downwards, look at what happens up here when I tip the foot in. It shoves, do it with my shirt here, it shoves the thigh, the shin bone inwards. So if your alignment's like this and you step and your arch collapses, it'll pull the shin inwards right here at the knee joint, the same joint alignment problem that I'm talking about. Now, this doesn't happen instantaneously. If this is how you tend to walk and move, and then you overdo it and your muscles they get tired pretty fast because they're not prepared for the activity that you're going to put them through, then you're setting yourself up to eventually get a shift like that. And so having arch supports can be beneficial for this, but it's not going to be the main thing that fixes it. What I look at in somebody who's got weak foot muscles and it's setting them up for this knee shift problem that can set up the meniscus tear is actually the toe strength. So if you look at the toes, when you curl your toes, those muscles that curl the toes actually run right under the arch of the foot and can provide you with a natural arch support, the way that it's supposed to be inside your foot. So if you get stronger muscles that curl your toes, and there's some other muscles, posterior tibialis is another one that it doesn't go to the toes, but you'll fire it appropriately when you learning the proper exercises. Then you have good support from the bottom of the knee going up into the shin, and then that, in addition to good glute strength up in the hip, combines for awesome stability in the hip, so that in the knee, so that you're less likely to shift those bones. And then during movement that you bend your knees properly without those knees collapsing inwards together. So I hope that helps out there. The Yuha, I'm sorry, I'm not sure if I'm pronouncing your name right. He says, when can I begin 60-pound weights like bags and toe exercises? 60-pound weights depends on your current level of strength. I mean, if you're not very strong right now, you're not able to pick up 60 pounds. If you're not even picking up any weight, then you might wait until you can first pick up 5 or 10 pounds and work your way up to 60-pound weights. And I assume, we're talking like walking or weightlifting, whatever the activity is, you always have to work your way up gradually. You don't want to go from, not picking up any weight to 60 pounds right away. You have to climb your way up there gradually. And then as far as toe exercises, the first thing I'll have people do just to activate those muscles is just curl the toes. Just bend them like that, like you're making a fist with your foot, and hold it, but not cramping, because you can cramp very easily. So I'll usually just slide my shoe off. So if you curl your toes up and down, just curl them down and try to get every toe to curl, and you'll feel those muscles working right away. And once you get good at that, then you can start to figure out how to put those toe curl exercises into your standing exercises, into your weightlifting exercises, into walking. That needs to transfer into other exercises, but at least just first waking up the muscle by curling it. We hold it for anywhere from 10 to 20 seconds. And when we're first starting to strengthen people's toes, we'll start with doing this hourly. So I'll tell people, hold for 10 seconds, do it 10 times in a row. That'll take you a couple of minutes, 2 or 3 minutes. And then do that every hour for the first week or two. Once you can get good range of motion, you're not cramping anymore, you feel like you got good control over your toes. Now we're ready to transfer that into standing and walking, into weightlifting, and eventually you can get into, picking up 60 pounds and walking, like if you're carrying some heavy groceries or something like that, or lifting weights in the gym. But first, you've got to wake up those toe muscles. You can't assume that they're going to activate properly as soon as you hit the gym if you've never tested them before. So I hope that helps you out. Hey, Miriam Roche is on here. I purposely try to turn my knees out when standing up and sitting down to keep the pressure off my knees, and it's more comfortable. That's exactly what I tell my patients to do here in the clinic. I'll make them put my knee down. I'll make them aware that their knees are going in and out whenever they're standing up. So sometimes on the first visit, I'll say, hey, you stood up like this, and I'll exaggerate. Your knees went in together and then out. Your arches fall when you do that. And then when you sat down, you did the same thing. So I'll literally tell them, just keep those knees out. And as long as, if you're a lady, as long as you're decently covered and everything, otherwise, bring the knees together for your modesty. But if you can do this right here, knees out, and stand up like that and sit down like that, that's much healthier for your knees for the long term. And you don't want to be practicing the knees coming in, because then you're just, it's like bending a paperclip back and forth, or a wire. It's just a matter of time before it breaks. And in the case of your knees, it's not going to break, but it's going to get injured. You're going to irritate it. And that shift can happen after you've done it, the 900th time. So I hope that helps you out there. Everyone else that's listening, great comment, Miriam. Vinny says, I have of outer knee pain where the kneecap ends on the outer side, just next where it has gap kind of below the knee joint line, I think. Okay, so it's hurting like in this area. Here's my kneecap right there. That's my kneecap. So you're talking about like right out here near the joint line. That could be a lot of things, Vinny. It could be your meniscus. It could be the actual kneecap cartilage itself. There's ligaments, the joint capsules in the area as well. The IT band is pretty close to there. It's insertion. So I would look at you're saying below here. It could be the patellar tendon then as well, the tendon that comes off the patella down into the shin bone. You probably need to look at your glute strength, because if you're, like I said, bringing those knees together when you go to stand up and squat or move around, you're going to tension that kneecap. So here's the knee. You're going to tension the kneecap against the thigh bone because you're using the quads too much. And then that tendon that runs down from the bottom of the kneecap to the shin bone also gets tensioned. And it's just a matter of what's the weakest link in the chain of tissues. And if your tendon right here is getting pulled quite a bit, that might be what becomes affected. It's some patellar tendonitis. But the root problem is usually fixing your movement, fixing your glute strength, just like I've discussed here with the squatting and making sure your glutes and your feet are also strong. All right, so let's see the other comments we got here. I do concrete work. Okay, I'm doing 20-minute session for posture daily now. Fantastic, thank you. Yeah, you're welcome, of course. All right, I've got just a few more minutes left here before we have to wrap up. So let me go into the treatment that you would do to fix your knee joint on your own if it's aligned this way where the inside's sticking out. Let me see if I can get some close-ups as well. So if you go on the inside of your knee here and you feel that edge that's sticking out, like I showed you on the skeleton, Let me just put my joint over here. Go down just a bit more. So the proper alignment should be about right here where the knee joint line is. The thigh bone should be pretty much vertical with the shin bone on the inside. And so when you just rub over your skin lightly right here, of course, over your pant leg's fine. As long as you feel that it's vertical where it's bumpy and bony right there, then that's proper alignment. But if you feel like that, there's a ledge here, like there's a bump sticking out, and then you rub and it's tender and painful on top of that, then you probably have this shift sticking out inwards. And what you've got to do is put your hand right above the knee joint. So I'm going to do it on the skeleton first, and I'll do it on myself. On the outside of the leg, so you're going to be pushing this way. And then on the bottom part of the leg, you're going to be using the palm to push the other way. So it looks like this on yourself. You rest your foot down. Foot needs to be relaxed. Leg as relaxed as possible. And then you're just going to put your hand right here above the knee joint. The other hand right here below the knee joint. And then you're going to bring your elbows like so. And you're going to push pretty much as hard as you can. Stay off the tender spot. You don't want to push the tender spot. You want to push right below it and then above the knee joint on the outside. And you could do like 10 reps like this, 20 reps like this, and just shove that knee out this way and in this way. And if you're doing your other side, you're going to switch your hands. So this is my left hand. My left hand would be on my shin on my right leg, but now I'm going to move my right hand to my shin on my left leg so that I can push out this way. And then my left hand's going to be above. You're going to just push this way because this can happen in either knee. You just have to feel that same spot to feel that ledge sticking out. And you're just going to shove like that. Like I said, 10 to 20 reps, really as much as you need to. And what you should be able to feel is that ledge right where you were feeling the edge of the bone should reduce a little bit. It should go down. And then after that, you've got to keep the position of the bone. The quickest way to keep the position is short term. It's not a long-term thing. Is going to be to slide the foot just like so. Take off your shoe so that your foot slides. And then you're going to turn your foot in like this so that you rotate your shin. So that you rotate your shin inwards like that. That helps to set up the alignment right here. And then you're going to bend your knee like that. And that's going to activate the inner thigh hamstring muscle right here on the back. Shouldn't be aggressive at all. It's almost like you're dragging your toes on the floor like that. And you're just pulling inwards and do about 30 reps. Shouldn't hurt. Should feel just fine to do this. And after you've done 30 reps, your knee should feel a little bit better if that's the problem that you were dealing with. You might need to do this treatment over and over. If you had a little bit of an improvement, that's great. That means that you were successful with this. So you might need to do this again here in the next hour or 30 minutes. And you might need to be doing it every hour or so for the next few days. It just depends on how severe your problem is. If you find that you keep getting benefit, I would keep going until you stop getting benefit from this. Now that's a short-term exercise. Long-term, like I said earlier in this video, you need to go look at your glute strength. You need to start working on how you're moving the alignment of your knees whenever you sit down and stand up. Like Miriam was saying, you need to stand up and sit down with your knees kind of pointed out. Look at maybe getting foot supports, the arch supports for the inside of your arch here to make sure that your shin bone isn't falling in. All those things combined together are what sets you up to not have this problem recur over and over again, which helps you to prevent a meniscus tear or a current meniscus tear from becoming worse. So I hope that helps you out. Now let's get to these comments, and then I got to get going here. Ruxana Vergi says, Dr. D, how do I know if I have torn cartilage and what exercises can be done for that? Ruxana, that depends on your MRI usually. Cartilage doesn't show up on an x-ray, it shows up on an MRI. The symptoms of it, what you would check on yourself is usually stiffness in the joint. Some swelling can happen as well. Sometimes a loss of motion if it's very severe. But cartilage can heal, not regenerate, heal if you give it its time, its space, if you basically rest a bit. And you do need to move in a very gradual and slow way. So it's if you treat it like that and it does get better, that's more confirmation that it was probably a cartilage injury. But if you're not 100% certain on yourself, your best bet is to look at going to go get an MRI at a medical facility to have your cartilage scanned. So I hope that helps out. Aim to be TOL says, hi, doctor. Hello, good to see you. Catherine74 says, hi, I'm from Scotland in the UK. Hey, from Scotland. I've been trying all your tips on walking and switching on glutes, improve my knee pain, but my range of motion is awful. Anything you'd recommend exercise-wise? My question would be, well, is your range of motion stopping you from walking or doing anything? Because if it's not, then it might just be your genetic allowable range of motion. I'm not very flexible myself. If I were to hop into a yoga studio, which I have done before, I am probably the least flexible person in the room. But that's not a bad thing. Flexibility is overrated, in my opinion. If you have enough motion to do your daily activities, you can reach your feet. That's important, right? You got to be able to put on your socks and shoes and do foot care stuff, clip your toenails and that kind of thing, wash your feet. Then you have enough flexibility for your daily activities and for most things in life. But if you're not as flexible as the yoga instructor or somebody who does yoga regularly, then that isn't as important. That's just maybe a desire of you to gain more flexibility. So I would say just check on that. If you are lacking range of motion to do your normal activities, then you probably do need to maybe do a little bit of stretching. You definitely need to get stronger. That tends to promote your motion. And you might even need to see a medical professional, like a manual therapist, who can stretch out the joints, because you might have a joint restriction limiting your motion. It could be the beginnings of arthritis as well. So Catherine says, osteoarthritis really bad, but definitely can move and do stuff. Just can't kneel on my knees. Yeah, so you might have an arthritic restriction in your knees. That's something that a physical therapist should be able to help you out with, and you need to keep getting stronger as well. Miriam says, a scan will show torn cartilage and Dr. D's knee program will heal it. Oh, it's working for me. Yeah, the knee program, thanks for reminding me, Miriam. We have a knee program that helps out meniscus problems and like this tibial shift problem. It can help you. It can show you how to fix the muscle imbalance that sets that up, how to get your glutes stronger, your feet stronger. This program is called the 28-day Knee Health and Wellness Boost Program. We'll link in the description below. If you're dealing with some chronic knee problem, like a meniscus issue, a cartilage problem, a knee arthritis, go check that out. That program has helped out so many people, and it's costs less than one visit to a physical therapist's office, and you can use it as many times as you like. It's a 28-day program, but currently we don't have any limits on how long you have access to it. So what a lot of people are doing is they'll run through the program once and then do it again and again, as Miriam has done, and they keep getting better every single time they go through it, because it's fixing the root problem. It's making sure that your glutes are getting stronger, your feet are getting stronger, and it pays close attention to not overdoing it in your knees. And you can always modify the exercises based on your current level of activity. So let me just get the last few comments here. Deef Allah Bani Hamad says, love your work. Oh, thanks. I appreciate it. And I'm happy to do this. I just want people to not suffer more than they should and not have to have unnecessary surgeries and injections and have to be taking pain medications. Kathleen, we're answering your question, which I never read, by the way. Let me read that real quick. Kathleen said, hope you see this question. Can a knee alignment problem cause a meniscus tear? I was operated on the left knee in 2016 for a meniscus tear. I just discovered I have another one after 2 flares last year. I also have a horizontal tear in my right knee after a fall in cement in February 2020. And PT has helped, but not lasting. I use a walker most days. So I hope we answered your question at the beginning of this video here. It's a knee joint alignment problem that can definitely set up a meniscus tear, but you just have to fix that alignment problem. And you can't rely on medical professionals to know what it is. So hopefully the techniques I showed you here can help you out. We've got other videos that go into it as well. All right. So then Chris Grant chimed in and says, I think I have an ACL tear / damage from one long distance cycling trip. Do you have any experience with people who have this injury? And is it a common cycling injury? Yeah, it definitely is. An ACL tear is a ligament inside the knee, the anterior cruciate ligament. The most common way to tear it is by some accident, like a fall, somebody falling into you. Football, basketball, soccer sports are a common place for ACL injuries. but it is possible to have an ACL injury by just doing some repetitive activity. Because if your motion is not quality, if your muscles are out of balance, then you can slowly stretch out that ACL and develop a laxity over time that can eventually turn into a tear. And cycling is one of those very repetitive motions that if you're not doing it properly and you have all those muscle imbalances, it can definitely set you up for an ACL sprain or tear. You need to go look at getting braced. Our 28-day knee program is definitely a program that I would recommend for an injury like that. So hopefully that helps you out, Chris. Catherine says, thank you very much. Miriam says, why does arthritis cause so much stiffness? Great question. Arthritis causes a lot of stiffness because the joints, anywhere there's arthritis, there should be smooth motion in the joints. And if there's been a lot of excessive pressure to the joint over time, the joint adapts by making itself thicker in some areas. Just like you get callus on your skin, that's a skin adaptation to extra forces on the skin. Well, the joints, the cartilage, the bone adapts by getting thicker. And now the smooth surface is no longer smooth. Now it's a little bit lumpy and bumpy. So that decreased, that adds more friction to the joint, which can create that stiffness. So that's why people get stiffness. And not to mention the pressure from muscle imbalances. Because like if we're talking knee arthritis, your quads are probably going to be over dominant and strong, which is going to compress the knee joint. So not only is it a bumpy surface, but now let me get my knee rather than my hands. So now the surfaces on the end of the bones here are bumpy, but now the quads and maybe even hamstrings are compressing the joint. So now you're having bumpy motion with compression. That's why it just feels stiff when you first go to move. Okay, Miriam, I answered Miriam's question. Kathleen says, yes, lots of information. We'll join your 28-day program. Great. I hope to see you in there. And then Susan says, hi from Newcastle, Australia. Awesome. We're in Australia. Okay, Chris chimed in, says, after 5 miles, I get pain and then I have to walk. Thank you. I'm going to try the program. Big fan of your work. Awesome. I hope it helps you out. That cycling is great overall for the long term. Of course, it's lower impact on your knees, but you have to learn how to do it correctly. And there might be some muscle imbalances that you're carrying into it that's setting you up for this issue. You're welcome, Miriam. Miriam says, thanks, Doc. That makes sense. All right, here's the last comment I'm going to answer, and then I have to go. Roxana Vergi says, indeed, I'm a huge fan of Dr. D's work and advice. Great guy. Thank you. Oh, thank you so much. Hey, thank you so much, everyone, for joining us live. If you're catching us on the replay here, thanks so much, friends. Give us a thumbs up if you're here live and on the replay. It helps us to get out to more people so that we can get this information in front of people that really need it. YouTube's algorithm loves people that like our videos and then that share our videos as well. So if you want to share this on social media or just send it, literally send the link to a friend, text it over, WhatsApp it over, whatever way of sharing it, it helps us out so that we can get in front of more people and get some good quality information. So not taking medications and having injections and surgeries that they don't need. Thanks so much, friends, and we'll see you in the next video. Bye-bye.